Hello, I'm Dr. Sarah Williams, speaking to you from the UK. Today, I want to talk about a medical emergency that can turn deadly far faster than... As a doctor, I've seen patients arrive at hospital far too late, simply because the early warning signs were missed or misunderstood at home. What makes this condition so dangerous is that it often starts with something that seems harmless, a cough, a urine infection, or a small wound that doesn't heal. In this video, I'm going to show you simple checks you can do at home that may help you recognise serious trouble early before the body begins to shut down.
Seniors, are you aware that sepsis can cause organ failure in as little as 2 hours? Even when an infection begins as something minor, such as a sinus problem, a small cut on the leg, a urinary tract infection, or a simple cough, it can quickly become one of the fastest progressing medical emergencies known. What concerns me most, as a surgeon with more than 32 years of experience, is that many older adults do not recognize the danger until their bodies are already failing. Sepsis pushes the immune system into overdrive, releasing large amounts of chemicals into the bloodstream. These substances begin attacking vital organs, including the heart, lungs, kidneys, and brain. As this process accelerates, blood pressure can drop, breathing patterns may change, confusion can set in, and organ injury can start within minutes. Here is the part that is rarely explained clearly. Sepsis almost always shows early warning signs at home before it becomes life-threatening. Having treated thousands of seniors, I can say honestly that sepsis can often be stopped early if you know how to recognize the first signals your body sends. This does not require medical devices or complex testing. It simply involves a few easy checks you can do at home that help distinguish a serious condition from a common cold or minor infection. I have seen patients survive because these early signs were caught in time, and I have also seen others decline because no one knew what to watch for. That is why this video matters. Today, we will cover 5 effective home checks seniors can use to identify sepsis early, ranked from least urgent to most critical. Stay with me, because check number 2 is considered by major hospital systems to be the most reliable early indicator and can appear hours before the body begins to shut down. Reference information is listed in the description. Before we continue, let me ask you this. Have you ever had an infection that suddenly worsened overnight? Share your experience in the comments. I read every one. Now let's begin, because home check number 5 is something many seniors overlook until it is too late. Let's start with a test that takes just 2 seconds but provides valuable insight into what is happening inside the body. This is known as the capillary refill test, and it measures how well blood circulates through the smallest blood vessels. When sepsis begins, one of its earliest effects is disrupting normal blood vessel function. Vessels may leak and lose their ability to tighten and relax properly, reducing blood flow to the hands and feet. This change often occurs before other symptoms develop, which makes skin checks especially useful for early detection. To perform the test, gently but firmly press on a fingernail for about 2 seconds until it turns pale. Release the pressure and count how long it takes for the pink color to return. In someone with healthy circulation, color should return in under 2 seconds. If it takes 3 seconds or longer, particularly if this is different from their usual pattern, it may indicate reduced blood flow. In seniors, this test becomes even more informative when combined with a visual skin check. Look at the arms, legs, and torso for modeling. A blotchy, lace-like pattern with purplish or bluish areas, mixed with normal skin tone. This occurs when blood is redirected away from the skin toward vital organs, which is the body's emergency response to serious illness. You may also notice that the skin feels unusually cool, especially on the hands, feet, and lower legs, even in a warm room. Some people describe it as clammy, similar to touching a damp cloth. When slow capillary refill, mottled skin, and cool extremities appear together, it should raise immediate concern. Poor circulation can occur for many reasons in older adults, especially those with diabetes or heart disease. What matters most is a change from the person's normal baseline. If their hands are usually warm and refill occurs in 2 seconds, but now their hands are cold and refill takes 4 seconds, that shift is significant. Make this check part of a daily routine, especially when any infection is present, even a minor one like a urinary tract infection or a small wound that is healing slowly. Check body temperature twice a day. Many people assume sepsis always causes a high fever, But this belief leads families to miss early cases in seniors. A major study published in Critical Care Medicine found that nearly 30% of elderly patients with sepsis actually present with low body temperature instead of fever. This condition, known as hypothermia in sepsis, is linked to poorer outcomes. As we age, the immune system responds differently. The body's temperature regulation becomes less reactive, and older adults may not develop a fever even during serious infection. For this reason, a temperature of 96 degrees Fahrenheit in a senior can be just as concerning as 102 degrees Fahrenheit in a younger person. To monitor properly, take temperature readings at least twice daily, even when the person is healthy, to establish a reliable baseline. Normal body temperature varies widely, and many seniors naturally run lower than the average 98.6 degrees Fahrenheit. Some may normally sit at 97 or 97.5 degrees. Once you know what is normal, deviations become easier to identify. Use a dependable digital thermometer and measure at consistent times, such as morning and evening. Oral readings are generally fine, but ear or forehead thermometers can also be effective if used consistently. Be alert for temperatures above 100.4 degrees Fahrenheit or below 96.8 degrees Fahrenheit, especially if these readings differ from the individual's normal range. Either extreme deserves attention, particularly when other symptoms or recent infections are present. Temperature can fluctuate throughout the day, so checking twice daily helps catch changes that might otherwise be missed. Keep a simple log of readings with dates and times, as this information is extremely helpful if medical care is needed. Respiratory rate, the number of breaths taken per minute, is one of the most overlooked vital signs, yet it is highly sensitive to internal stress. As sepsis develops, the body demands more oxygen to support immune activity and compensate for struggling organs. The lungs respond by increasing breathing rate, often before the person feels unwell. Research from the University of Pittsburgh showed that an elevated respiratory rate is one of the earliest measurable changes in patients who later developed severe sepsis, often appearing hours before other signs. Measuring this at home requires only a clock or phone timer. Check breathing when the person is resting and unaware they are being observed, as people tend to alter their breathing when they know it is being counted. Watch the chest or abdomen rise and fall and count full breaths over 60 seconds. 1 rise and fall equals 1 breath. A normal resting rate for adults is typically 12 to 20 breaths per minute, with many people falling between 14 and 18. In seniors, slightly higher numbers may be normal, but consistent rates above 20% at rest are concerning. Rates above 24% are worrisome, and anything over 30% requires immediate medical attention. Also note breathing quality. Are neck or shoulder muscles being used? Does breathing appear labored or uncomfortable? Can the person speak in full sentences without pausing? These details add important context. Establish a baseline on healthy D.I.s and compare during illness. An increase of just 4 or 5 breaths per minute above normal can be an early warning sign. The breathing count becomes especially important if the individual has an infection, was recently hospitalized, underwent surgery, or has chronic conditions such as diabetes, kidney disease, or a weakened immune system. These situations increase sepsis risk, making early detection even more critical. Breathing rate reflects oxygen demand, but another simple check can reveal how hard the heart is working to keep up. The heart acts as the body's main pump. When sepsis develops, it must work harder to maintain blood flow to vital organs. This strain shows clearly in the pulse rate, making it a valuable home monitoring tool. During systemic infection, chemicals released into the bloodstream cause blood vessels to widen and leak, lowering blood pressure. The heart compensates by beating faster. A heart rate above 100 beats per minute, known as tachycardia, is a common sign of sepsis. A large analysis published in The Lancet found that heart rates above 90 beats per minute, combined with suspected infection, strongly predicted poor outcomes if untreated. You can check pulse manually or with a pulse oximeter. For manual checks, place 2 fingers on the inside of the wrist below the thumb and count beats for 60 seconds. Normal resting heart rate ranges from 60 to 100 beats per minute, but medications and fitness levels affect this. Many seniors take medications that lower heart rate, making baseline knowledge essential. Record what is normal for the individual when they are calm and well. During illness, compare new readings to that baseline. An increase of 15 to 20 beats per minute is meaningful, even if the number still falls within the general normal range. Also note rhythm. New irregularity alongside illness is another concern. If using a pulse oximeter, monitor oxygen saturation as well. Normal levels are usually 95% or higher. Readings below 92% with suspected infection may indicate lung involvement and warrant prompt evaluation. This is the most sensitive early warning sign of sepsis in older adults and the one families most often overlook. A Johns Hopkins study identified changes in mental status, such as confusion, disorientation, unusual sleepiness, or simply not acting like themselves, as the earliest indicator in many seniors, often appearing a full day before other symptoms. Sudden confusion is not a normal part of aging. It is a medical red flag. The brain is extremely sensitive to changes in oxygen, blood flow, and inflammatory chemicals, which is why mental changes often appear first. To monitor effectively, understand the person's normal behavior. Are they usually alert, oriented to time and place, able to follow conversations and recognize family members? Once you know the baseline, watch for deviations such as new confusion, difficulty answering questions, unusual drowsiness, agitation, slurred speech, or trouble finding words. Casual questions throughout the day can help assess this naturally. Ask what day it is, what they had for breakfast, or refer to a recent conversation. What matters is noticing changes from normal. During any infection, mental status should be checked multiple times daily. If you seek medical care, be clear and persistent. Explain how this behavior differs from normal and when the changes began. Mental changes combined with abnormal temperature, rapid pulse, fast breathing, or skin changes should be treated as sepsis until proven otherwise and require immediate medical attention. We have covered a great deal of important information today. Sepsis claims more lives than heart attacks, strokes, and all cancers combined, yet most families are never taught these. Simple home checks. The 5 tools we discussed, the skin squeeze test, twice daily temperature checks, breathing counts, pulse monitoring, and most importantly, mental clarity checks, form a powerful early warning system. None of these require special training or equipment. They only require awareness and consistency. Consider printing a simple checklist and making these checks part of a daily routine, especially during any infection. Early detection saves lives, and time truly matters. If this video helped you understand how to protect yourself or someone you care about, please subscribe and turn on notifications so you do not miss important health information. Share this video with others who may benefit, because the more people who recognize these warning signs, the more lives we can protect. Thank you for watching.